My name is Brian Armaco, and today we're going to be using a Suresult D3 handheld ultrasound unit to evaluate an infant's hip for hip dysplasia or developmental dysplasia of the hip, DDH. Now what this is the hip joint. It could be sort of malformed. The joint can be a little too shallow, making it easy for the hip to dislocate. And the clinical test for this is called the Ortolani and Barlow test. There's two tests. Basically, you dislocate the hip and relocate the hip. And if you can do it just as easy as that, and you clunk and clunk, well, then you know that you have hip dysplasia. So it's a very specific test. But those tests are not very sensitive. And in fact, that combination of tests may miss 2/3 of hip dysplasia cases. So what's considered the best way of evaluating the hip for hip dysplasia is ultrasound. So wouldn't it be great if we could, with a cheap ultrasound unit, evaluate the hip in less than a minute and have our answer? And that's what we can do. We'll be using this and something called the graf method. We basically take one image in the coronal plane, we measure two angles, and we compare those angles to a chart, and then we have our answer. And it's as easy as that. I have a baby here, and we're going to take a coronal plane image with the leg at about 90 degrees. And here we go. And that's the image we want. We have the ilium here. We have the labrum here. We have the roof of the acetabulum here. We have our femoral head here. And I'm actually going to start with putting down a line. I don't actually want to measure any lengths here. But this is basically the line we need to measure from for our angles. And now I have two angles I need to get, our alpha and our beta. So there's our alpha. And we need a second angle for our beta. Our alpha in this case is 71.6, and that needs to be larger than 60 is normal. If they're less than 3 months old, then it needs to be larger than 50. And for our beta angle, we want our beta angle to be less than 55. So for my baby, it's larger than 60 because it's 71.6, and it's less than 55 because it's 48.6. So my baby is fine, which is great. And that's it. It's as simple as that. I'll add that if you're interested in one of Suresult's units, that they've asked me to mention that the shipping and duty and all that stuff, they try really hard to sort that all out for you. And they also try to make sure that the units meet international standards. And of course, if you have any questions, you can just message them on WhatsApp. And I guess that's it for today. Cheers.